Hey, it's Elliot, and this is my top surgery vlog. I had top surgery about a month ago, just a little bit more than a month ago. A lot of these clips my mom filmed the day of surgery, and I haven't watched, but I am so excited to say that I'm boobless. I like the TE joke. My one friend said boob bye, which I love. And I'm just feeling so much happier in my body now than I was 2 months ago, or even a month and a half ago. So thank you for sticking along for this journey. So I thought I'd do a little surgery medication tour. I'm on a couple more meds than most people would be after top surgery, or pre-top surgery, I guess, too. Because of my mast cell activation, we have to take a couple certain precautions. I have a mast cell like pre-surgery action plan from my allergist. So I have a couple more meds than some people. So I have the day of surgery, I have to take Singulair, which I don't usually take, and then I also have prednisone, so I have to take one the day before surgery and one the morning of surgery, because mast cells, when you have a mast cell activation syndrome, can react not always amazingly to medication, to anesthesia. And then after surgery, when possible, I'll take Tylenol. But then I also do have oxycodone, which wasn't ideally I wouldn't be on. However, they wanted to put me on Toradol, but it has I guess an interaction with one of my medications, so they had to order this instead. And this is only for 7 to 10 out of 10 pain, so I won't be taking this. As much as I can avoid taking this, I'll avoid taking this. Otherwise, Tylenol, which I already take on a daily basis. And then I have this Cefadroxil, which is an antibiotic that I'll take after surgery to prevent infection. And then I have some as-needed anti-nausea medicine. So yeah, that's my medicine tour, I guess. So like I said, I'm on a couple more medications than just anyone would be on with top surgery, but you know, taking some extra precautions because of my health. And yeah, now I'm very rambly, but I guess I'm a little nervous, but that's my surgery tour. Not my surgery, my medicine tour. Driving to get COVID testy. And there's a really cute dog, and that's what I have to say about that for right now. So I heard that the COVID testing would be uncomfortable. Nothing could have prepared me for the way that felt in my nose. I did not realize just how much space there is in that nostril. Yeah, but I need to get there. You know, you've probably heard, but everyone going into any kind of OR right now needs to get tested before you go into the OR. Also driving in, so I'm getting my surgery done. I live right outside Philly, and we had to drive into the city to get the testing, and it's wild to see. Right before we got to where we were going, we passed like a whole bunch of National Guard and police getting ready for the protests that are going to happen later today, and it was just kind of surreal. And seeing all the boarded up windows for shops and stuff really kind of is making some of this real. I haven't been able to go to protests because I don't want to risk my surgery, but I know my sister was in the city yesterday, and my heart goes out to the people who are being affected by Black people who are being affected by police brutality, and I really just wanted to make sure I said that, and that I let people who are protesting right now know that my heart is with them. So that was half COVID update. Half. Oh shit. There's military in my city. So yeah. So it's the night before surgery. I'm trying to go to bed early tonight, as you can tell. Well, I don't know if you can tell, but it's still light out. It's about 7:40 right now. But I have to be at the hospital at 6:15 tomorrow morning. And so I want to try to get there by 6, which means leaving around 5:30. So waking up at 5, which is earlier than I've woken up since like maybe my sophomore year of high school. And when I was a sophomore, junior in high school, I went to bed at like 8:30. So I'm trying to get everything ready. I already have my outfit laid out for tomorrow morning. I'm about to do my meds for the week because I do that on Sunday nights. But I just took my Hibiclens wash, you do it before surgery. So the way it's like antimicrobial like antiseptic type wash. So what you do is you take a normal shower, and then you rinse off, and then turn off the water, and then with like a wet washcloth, you for 5 minutes put the Hibiclens all over your body except for your like face and head and like genitals and stuff like that. So basically it helps protect against like infection in the operating room or whatever. And so I did that, and I'm packed stuff that I need for the morning for the most part already. I can't eat. If my surgery was later in the day, I could drink like clear liquids earlier in the day, but you have to stop drinking that 2 hours before surgery. So I'll just take enough water to take my morning meds. It's wild. As you can tell, I'm already in my pajamas. My mom's not used to waking up this early either, so my dad he hasn't in a while, but he's used to waking up pretty early. So he's gonna help us make sure we get up. And I'm not sure if there's curfew for tomorrow morning in Philly, but I'm a little nervous about that, I think, just because the past couple nights there's been like an 8 p.m. to 6 a.m. curfew in the city. We live outside the city, but yeah, I'm a little nervous about that, but all shall be well. I'm also, I guess, like, I've never actually had, like, surgery before. I've had, like, abscesses removed from my armpits, which is gross, but I was awake for that. They did, like, local anesthetic, that was pre-EDS diagnosis, and now that I know I have EDS, I'm like, oh, that explains why I could definitely still, it wasn't like I could feel all of it, but I could definitely still feel it. But oh, and I had like twilight for when I had an endoscopy, but like that's not surgery. So I guess I'm just like worried about the what ifs, you know. I have to show my mom how to take a video on my phone so that she can take some footage, because I really want the reaction of when I'm waking up. Yeah, this video is gonna be mighty long.
Alright, I'll talk to you in the morning.
It's 5:30 a.m. We're on the way to the hospital. Mom, say hi.
Hi!
That was loud. I love you.
Snip.
You didn't need to say that. You really didn't need to say that. No curfew today, too. I was worried that there'd be a curfew because the city's had curfews the past couple days, but there wasn't, so I'm not worried about that anymore, which is good. I mean, I'm sure it would have been fine either way, but yeah.
I'm all changed. I took my surgery gown. I'm talking quietly because there's not a door. There's just a curtain, but they took me back, and now we're just waiting for my mom. Yeah. I just signed all my consents. I forgot to mention, I'm getting my IUD out and replaced. So I saw gynecology, I saw plastics, and I saw anesthesia. I signed everything. They marked up my chest, so ready to go. Still waiting on the IV.
All right, so I'm here with Ellie, who's gonna get rolled into the operating room.
You sound like on your videos from when we were little. You used to do the same.
I'm narrating. How are you feeling, Ellie?
I'm feeling good. Got my IV. Signed all the consents.
Pretty exciting. Ellie's gonna look a little different after all that.
I already look different. I have these fancy little lines.
Yeah, Ellie's got lines drawn on, and so we're feeling good. Took us a little while to find parking, but everything else is going well. The anesthesiologist did a really good job putting the IV in, and obviously I hope the surgeon does a good job too.
I mean, that one would hope.
All right, good luck, Ellie.
On our way home. Surgery went well. I'm still in a little bit of pain, but not too bad. We ended up staying, it is 3:50. We left at like 3:45. I ended up staying a little bit longer because, so in addition to getting top surgery, which is the main thing, I also needed to get my IUD taken out and replaced because it had to be under anesthesia, and I guess that caused some issue, and they needed me to pee after surgery, so then that didn't happen, so I had to get straight cathed. So I'm fine now. As long as I pee in the next 8 hours,
You
I'll
peed
be
in a
fine.
bag.
No, technically I peed in like a bin thing and then some jars.
Oh, okay.
Sorry, Mom. That's like if you have a long-term cath, if it's a bag. It's a bag. So as long as I'm able to pee, I won't have to go back to the hospital. So, but the upside to that meant that I'm now the anesthesia.
Take the I-76 West ramp.
The anesthesia has it completely worn off, which is nice because I was kind of groggy. I was trying to listen to music, and that helped, I guess. When I first woke up,
Oh my God! Don't be assholes.
oh, people are driving like assholes, I guess. They did a
Merge onto I-76 West.
Just fuckers, let me over.
my mom has road rage a little bit, not really. People drive kind of aggressively.
Do we need to
In the
drive
city.
50 on an entrance ramp? Especially when the traffic we're coming into is at a complete standstill?
I guess there's a tailgater. This city Philly is an old city.
Continue on I-76 West for 6 miles.
So the roads aren't necessarily all, there's not a lot of space for the amount of traffic
You
some
should
of the
get the
roads
skyline in your
get.
video.
Oh, I don't know if I can because it's skyline. I don't know if you can see the skyline because I kind of have to turn the camera around. I'm not able to flip it. Oh yeah, you can see the skyline. Philly skyline and construction signs. I feel like there's always construction on this road.
Yep.
What was I saying? Oh, what ended up happening was I got, they did a nerve block, so to help with the immediate pain after surgery, but they suggested taking one of the Oxy tonight, because it'll probably wear off overnight, so I'll probably wake up in pain. I'm gonna try not to take too much of that. Try to stick to Tylenol when I can.
And give the rest to me.
Mom, you need to clarify for legal reasons that was a joke.
Oh, that was a joke. That was a
You
joke.
don't say for legal reasons.
For legal reasons, that was a joke.
It was a joke. It's not just for legal reasons. That was a joke. It's a joke. You know, when I'm done with the oxy, it's going immediately to, I have some other meds that aren't like high risk meds, but some other meds that I need to
So
take
do
to
I.
a med drop. The one CVS, the CVS in Bryn Mawr has a med drop.
Okay.
Yeah, so I had that, and then, so I have, and so when I first woke up, I was so out of it, but now I'm like realizing, I'm like, oh, it almost feels like my chest is, not, I think it feels concave right here because I'm touching the drain, because I have these fun little drainy thingies. My sister didn't want to see them. She's gonna have to see them because they're just hanging off of me.
They're pretty.
They're not pretty. And I have to like dump them into, when I was practicing doing it, I accidentally squirted blood from it onto my leg. Fun times. Yeah. So I go back on Tuesday, not tomorrow Tuesday, next week Tuesday, to get my bandages off. I'll have to call the receptionist, or not I don't know what the right word is. His assistant, I guess would be the right word, and ask about the compression vest. And yeah, so, and I can still shower with this. I just have to face away from the water because there's, I have my bandage, but then there's also like a waterproof layer on top, which is nice. Yeah. And did I miss anything? Top date, Mom? But yeah, I have a flat chest now. I don't know
if they want to see your blood bags.
I already showed them my blood bags, Mom.
Oh, okay.
They're kind of impossible to not see right now. So there's just, you can see some of the bandages here. Ooh, and then in a week when I go back, I'll get to see my new nipples. I mean, they're not new nipples. They're not new nipples. Wait, make that face again. My mom did not like the phrase new nipples. They're not.
I'm imagining that your new nipples are not going to look fabulous in 2 weeks. Like,
No, in 1 week.
in 1 week, they're probably not going to look fabulous.
But I'll get to see my chest in a week.
Okay.
And my new nipples. There's this one TikToker that I like, because I guess they like check in about how you know what's the nipples. One TikToker who was like, I wonder if I could find a top surgeon who would give me nipples that are shaped like a heart. I think it's a joke, but also like, you know, if you're gonna get surgery, why not get heart-shaped nipples, you know? I did not get heart-shaped nipples. Nor would I want heart-shaped nipples. I think that that's not the look for me. And we're gonna go and get some fries and Dr. Pepper,
And coffee.
because we woke up early. Well, I slept for several hours. I mean, it's with surgery sleep, so I don't know how much of sleep that is.
They can see the river?
The river! Well, now there's trees, so they can't actually see the river, Mom.
It's the Schuylkill River.
Yeah. But it does...
It means full of fish.
Really?
Yeah.
Oh.
In Welsh or something like that.
Yeah, it's spelled weird. You would not know that that's how you pronounced it looking at it. GPS pronunciation around here is fun. We had a hard time finding parking. The parking lot for Penn is really... It's because Penn's such an old hospital, and it's in such a crowded part of, like, it's in the middle of the city, so there's just not a lot of space for things, so we got a little lost.
And also, let me give a really big pro tip about Penn. Don't film video of your kid being wheeled off for top surgery.
The thing is, the people
because they will come and bust you.
The thing is, the people who were pushing me out were fine, like, didn't say anything.
Yeah, they were waving and smiling at the video camera, but the nurse manager
was like, no.
Busted my ass.
Yeah, so I wasn't able to get much footage in the actual going back, but that's fine. It is what it is. I was gonna clip out the parts with their faces anyway. I was just gonna, but it's alright. It's not a big deal. Sorry. Not in a lot of pain. I'm in a little bit of pain, but it's bearable.
Is the seatbelt?
No, just that going forward motion is, hey look, there's my other doctor's places. I could see my doctor in the ad for that one. Sorry. got distracted. But the top. Oh, and we're gonna go past my other doctor. We're gonna go past my neurologist's office. What was I saying? Oh yeah, I get to. But it's when I first woke up, I was so out of it, I didn't even really realize. Like, I didn't look down at my. Like, I vaguely remember moving. Like, I remember going into the OR, and I remember like the doctors talking, and my my gynecologist was there, and I've seen her a couple times. She's really nice. She's so nice.
She was the one who was smiling and waving at the camera.
I wonder if CHOP has different rules about that than Penn.
Oh, that's an interesting thought.
Because she works at
The
CHOP.
nurse manager said, here at Ravden, we are very strict about blah, blah, blah.
Alright. But yeah, my gynecologist works at CHOP and Penn. And yeah, so I remember going back to the OR. They put the IV in before we went back to the OR. They put something to relax me in my IV, and then
The anesthesiologist was real cute.
which one?
The one
girl?
who put the IV in your
Oh,
hand.
he was really nice.
He was also nice and cute.
Well, thanks for that. Do you want to go to that McDonald's or McDonald's at Ardmore?
Oh, we can go to one.
It doesn't really matter which one we go to. That one just seems like it'll be a pain to get to from
Yeah.
the street. What was I saying?
The IV in
Oh
your
yeah,
hand.
yeah. And then I remember they were putting down the like this thing. It took me a while because I think I didn't have it on hard enough. But then I fell asleep. I don't remember falling asleep. That's just not how it works. And then I vaguely remember I woke up and I was in the post-op, and then they had me move from the bed thing to like a reclining chair. But I was still so out of it and sleepy, kept kind of falling in and out of sleep. But now I'm out of it. I'm not out of it anymore, and I have flat chest. It's not like completely flat right now because of the bandages. And then when I felt it at first, I was like, "Is it concave?" Then I'm like, "No, it's just because the drainage bag thing." I need to figure out a strategy for what I'm gonna do with these drainage bags, because this is gonna absolutely gross Charlotte out. She's gonna love that I have just they look kind of like grenades when they're full. Did you notice that?
Yeah, I did.
So I have to drain these into little jars. When I was practicing, like in the room, I squirted blood on myself.
You know what? There's, Daddy has a lightweight blue and white striped bathrobe. I mean, it's really lightweight. Like, it's this kind of fabric that your shirt is, except even thinner.
I might not want to walk around in that but yeah, maybe. We'll see. We'll see. Charlotte's gonna have to see them at least once. Whatever. Yeah, now we're rambling.
Yes, now we're rambling.
I always ramble, though. That's a thing I do. All right.
Okay.
Bye.
Peace.
I'm just sitting here processing the fact that I now have a flat chest. And I can take like a shirtless video. I mean, yeah, I've got my hella sexy bandage here. It was, earlier I was in the bathroom washing my hands, and I was still in my shirt, and I looked at myself in the mirror, and I said, and I just realized, like, for the first time since, like, I was, like, 12, 13. Chest. It's kind of gross. I just did my venting, because I have to drain those fluid baggies. But it's worth it. The pain right now, it's fine. It's tolerable, I guess. As long as I'm just kind of gentle with my body, it doesn't hurt too much. But yeah, I still haven't peed.
so I might have to go back to the hospital. I peed a little bit, but it wasn't like really. And I think it's just funny that out of the two things I had double mastectomy and I had my IUD replaced, taken out and put in, and it's funny because the thing that's causing complications is the IUD. So that's funny to me. You can see some of the marks he made. And the nerve block's wearing off, so I can start to feel here. It was funny because I was like, ooh, that feels weird. I think I have almost fully regained feeling. Maybe not entirely, but at least like peripheral skin feeling again. It was a little weird when I first started to wear it. I was like, what is that? I realized I never did an update video. I did not pee very much. I can't remember if I made a video about this, about how bladder retention. So I went to the ER this morning. Well, I mean not the ER, but yes, the ER, back at the hospital. And I have a catheter for a few days, so that's fun. I have fluid coming out of all kinds of tubes from my body. But apparently, that's not an uncommon reaction to anesthesia. Oh, and I have a UTI. I am now 2 days post-op. I just took my first post-op shower, really carefully, obviously. My surgeon said it was okay. I don't know if that's the case for everyone, because I have well waterproof bandages. My pain levels are like almost completely gone unless I accidentally tug on my drainage bags or something like that, or a little bit. So that I feel good. A little bit tired. Probably still catching up on the lack of sleep from the other day. But yeah. I got my cath taken out today. Good riddance. 1 tube down, 2 more to go. Also, it's very hot and my chest is very itchy. Yeah, itchy. Itchy. But the pain's good, which is good. So, I should stop. I'm, I believe, 4 days post-op, and I felt comfortable enough to put on a t-shirt today. The pain has gone way down. I'm able to move my arms a lot more comfortably. So, t-shirt time. I've been wearing button-ups or to sleep a robe, so I feel happy about this. I feel more comfortable in t-shirts anyway. So, I get my dressing taken off in 2 days. Yeah. And I'm fine, except, sorry, I don't have my mom keeps borrowing my tripod thing. I don't know where it is right now. Except my mask, though, it makes it hard for me to have, like, adhesives. Like, I had to stop wearing KT tape. And the past couple days, it's been getting, like, increasingly worse. The only pain I really have is that my skin feels like it is burning because I am reacting to the adhesive on the bandages. Like, kind of see it. Sorry. Where, like, the tape's starting to come off. Can I get... You can't really see it. But... Like... Do you see that? It hurts a lot. Like last night, I was having trouble falling asleep because of the bandages. I've been taking Benadryl occasionally when it gets really bad. But yeah, no like muscle pain. No like yeah, just burning because my, like, it's not just itchy, it like hurts. So I'm curious to see what that's gonna look like when the whole thing comes off. So sorry for the shaky. My mom has my tripod. But I got my drains out today. And the dressing taken off, which is good because I was reacting to the adhesive and my skin was burning. Now I have my, it's just an Ace wrap compression that I'm gonna have for the next couple weeks. I'm starting to get feeling in my chest muscles. Again, I have to do a little bit of bandaging on my nipples. Place so the nipple grafts are set, but it feels nice to not have the drains anymore. So, oh, and I found out that, so I haven't been having a lot of pain, but apparently that's not the normal thing to be not having much pain. I'm blaming it on the my high pain tolerance from EDS, so I don't know. So today I am making the choice to not put any more, or at least for right now, to not put the Ace bandage, the compression bandage, not compression bandage, just like an Ace bandage for compression, or like the gauze and tape on. But just today I actually wore one of my binders that were looser for the little bit of compression that I need instead of the Ace bandages, because my skin is just not having it. It's just so raw and delicate and sensitive that I decided it would probably be better for me to just give my skin a break, because just look how raw it is from the adhesive. And it's not like these, like, my nipples aren't all the way healed, but they're looking pretty good. And like this is fine, and I haven't had any swelling or anything. Sorry, I didn't grab my tripod, so the angle's bad. But I'm hoping this goes okay, because I just can't do it. And I know I haven't made an update in a little while. It's just been pretty flat. My nipples looked really scary for a while, but they look pretty good. This is not a flattering angle for me. Obviously, I still have some healing to go, but yeah, I'll probably post this video after my 1 month appointment. I know I could have made it more than one, but yeah, that skin does not look good, and it just hurts all in here. It's just so sensitive, because my chest skin's already my, like, where I have my, like, I don't have the soft, doughy, like, velvet skin many places in my body, but my chest is where it always has been. So yeah, this video is getting long. Peace. Today I had my 1 month post-op visit. I'm cleared to do everything. I am healing up really nicely. Like, my chest looks like almost normal. It's just like these pucker bits that are gonna continue to go away. My nipples look like nipples. I know I'm not using my tripod, and I should be, but yeah, I have to stitch this vlog together. But 1 month post-op. And that's the tea. Just kidding, it's not the tea. Thank you for watching. If you are someone who is waiting on certain gender-related transition things, medical transition things especially, like top surgery or starting hormones, I see you. It's really, really difficult waiting for that to happen. And it sometimes feels like this is never gonna happen. Like, I was supposed to have top surgery a year ago. It got canceled for health reasons, and it was really, really hard. But here I am on the other side of it now, and I'm so happy, and I want everyone to know that you'll get there too. Love you guys. Bye.